So hi everyone, thanks again for coming here today. You're all here for our alumni career panel. This one's focusing on working in health and mental health settings. My name's Nick Schmidt. I'm going to be moderating. I am a MSW intern here at Silver, and I would like to have everybody here up on the panel just take a few minutes, introduce yourselves, and give us a little bit, I guess, of your background. Like
Sure. Hi guys, my name's Lena. I graduated from NYU in 2014, and since then I've been a social worker at Mount Sinai Hospital. We merged with a bunch of other hospitals throughout the city and Queens and Brooklyn, but I'm at main campus on the Upper East Side, which is our original site. So I started there over 2 years ago, first on a team where we really worked inpatient and outpatient. So we would enroll the most psychosocially complex patients and physically complex, medically complex as well, when they came into the hospital through the ED, and then we'd follow up for 4 weeks post-discharge, working with the doctors and really trying to prevent them from continuing to overutilize the ED. For the past couple of months, though, I transitioned to sort of a half macro, half micro role. So now I work in one of our primary care providers' offices. There's like maybe 6 or 7 PCPs there, and I mostly just work with patients who have mental health needs. So if a patient comes in to see their doctor, any kind of mental health need, I'm coming into the room and I'm working with them really for as long or as short as needed. And then the other half of my job is through HR. I run programs for employees. So we're starting a stress management initiative and really just working on employee wellness. So that's sort of my program development role and less direct client work. When I was at NYU, I was not in healthcare at all at my internships, just purely mental health, individual counseling, and then at a psychodynamic institute. So when I graduated, I knew that the healthcare world was really something I knew nothing about, and decided to take a job at Mount Sinai that was going to be the biggest challenge for me and where I had the most to learn. But I think it's a really great opportunity if it's something, whether it's something you got to do, in grad school or not, to really be exposed to that. And then, of course, I've continued with the mental health.
My name is Brian. I graduated from NYU last year, 2015. When I graduated, I started working for Community Access in their health home, which is basically a program for individuals with dual diagnoses, typically medical and mental health issues. While I was at NYU, I was a grant recipient for a program for the primary and behavioral healthcare integration program, where I learned a ton about the Affordable Care Act, the healthcare system in general, specifically with New York City, mental health providers, all those things. Since then, I've been working at the New York City Alliance Against Sexual Assault, providing counseling and advocacy to survivors who are going into the emergency room for sexual assault services. So there's still definitely a healthcare component, especially for those that are uninsured who can't afford certain services and medications that are necessary following an assault. It was a great experience here in healthcare. I also say definitely try and get your hands involved in either both if you can, the medical piece and mental health, or separately, especially mental health, because that's something that you're probably going to continuously see throughout your career.
Hello everyone, thanks again for coming. My name is Katie Magis. I graduated from NYU in 2012, and since then I've actually been at Harlem Hospital the entire time, which was a surprise to me, but I've been in several different positions. When I started there, I was what's called a patient navigator, which is really just like a fancy term for a medical case manager in the outpatient HIV clinic, and it was a home-based program, so I would travel to patients' homes to provide health education and case management to help keep them engaged in their HIV treatment and care. And then after that, I actually got the opportunity to start a new initiative at the clinic, an HIV prevention program that had previously not been run there before. So I got the chance to do some more program development, which was pretty exciting. And now my job is very specific and unique. I work with something called PrEP. I don't know if you've seen any ads on the subways. It's like all over. It's basically an HIV prevention strategy that involves actually taking a medication to prevent HIV. So what I do now is actually help people who are interested figure out if that's a good option for them. So I do some counseling, but it's also a little bit more in the public health sphere because it's a lot of actually providing information. So that's a different role as well. But all of them I've enjoyed very much and learned different things. And like some other people mentioned, when I was in school here, my internships had nothing to do with the medical world. It was just the job that I accepted after graduation. So I'd say keeping your mind open is exciting to see where it leads you.
Hi everyone, my name is Brittany. Thanks for being here. I graduated NYU in 2015, and like it was mentioned, healthcare was not something I was involved in when I was in school here. I was really involved in like the global learning opportunity, and so after graduation I actually went down to Guatemala and I lived there and I studied Spanish. Because I felt like in my internships here that I had, one was in a school and one was in a social service organization, I had a lot of Spanish-speaking clients, and I just felt like I needed to learn and develop the language in order to provide services in New York City. So after I got back, when I was job hunting, one of the things I looked for was a job that would let me grow that skill set. And I didn't think I would land in healthcare either, and I was open to that, and so I work for Montefiore Hospital in their Next Steps Care Management Program, which is a health home, which provides medical and mental health case management services to people with co-occurring disorders, and a lot of people have complex medical and mental health needs, as well as a lot of environmental issues that impact them. So yeah, it's been an interesting ride since I've been here.
Great, thank you. It's awesome to see such a diverse panel within this industry. I know a lot of you mentioned that healthcare wasn't exactly your first choice, but if you could kind of go into a little bit of how you actually got into social work in general, and then maybe talk a little bit about your progression and how you feel right now in your current position. And that's for anybody who would like to answer.
I'll go. So I initially started off working with survivors of domestic violence, and I did that for forever until I got to NYU, where I was introduced to healthcare because that's really what I wanted to do specifically. And I really like the experience here, especially with the internships, working in mental health, and when I graduated, again, continuing into healthcare. I really liked it. It was very challenging, but I kind of realized through my job right out of school that I really liked working more with the survivor population, and so still being somewhat involved in healthcare, but that's kind of my transition out of it a bit.
So I actually started really in the public health world when I was younger, and I was running HIV/AIDS education groups to teens, and then was pre-public health in undergrad too, and as part of that you learn a lot about healthcare in your courses and whatnot. And when I graduated from undergrad, I went back to nonprofit world and was working with male survivors of childhood sexual abuse, and then also at a domestic violence shelter. But I wasn't really working one-on-one with clients. I was more doing community outreach and education and training, so I was still very much in the public health sphere. And I realized that in order to really do direct patient work as well, really need an MSW or some kind of master's degree in order to do that. So for me now, sort of being able to do both is really a combination of sort of where I started and just where my interests were. And I think we've all sort of touched on this, but now really how social work is, and of course there's a million different social work jobs and things you can do with your degree, but there is a lot of overlap, and there are a lot of positions where it's going to have both. Really, if you're in any hospital setting or anything, the healthcare piece is going to be there. So for me, it really just was a natural progression of, interest meeting.
I actually started as a psychology major in undergrad, and when I graduated, I really didn't know what I wanted to do with that, and so that year looked like working at a bookstore and a coffee shop. But I also volunteered at a hospital in the psychiatric wing, and that's where I really was exposed to social workers. Like, I had never taken a social work class, but they talked to me about what they did. I was interested. Then I got a part-time job working with teens with mental health issues, kind of like a peer person to come take them out in the community and work on skills, talk about their mental health. And so from there, I really just asked a lot of people that I encountered, this is what I like doing, what should I do next? And they all kind of pointed me in the direction of social work. So that's when I decided to come here. And then after school, I'll be honest, I'm pretty open and I like every opportunity I've ever worked in. And so I really just would have done anything in the social work profession to get to work directly with clients. I knew that was important to me, and so the first opportunity was at Harlem Hospital, and so I took it.
For me, when I was younger in my 20s, I had a substance abuse issue, and so when I got into recovery, I interacted with a lot of social workers and therapists, and I knew I wanted to have a career in some way that I could be a therapist and work directly with people and give back in some way, but I didn't know what that looked like, and I spent 5 months abroad out of the country for the first time in my life, and I was exposed to different communities and different cultures, and I saw the way, systems of privilege and oppression affect people, and I came back and I wanted to have I knew I wanted to get my master's, and I honestly stumbled upon NYU's program by looking at the interdisciplinary master program, and all the classes that I wanted to take were in social work, and it never dawned on me until that moment that why don't I do social work? Because I'm from Florida, and in Florida there's just not a large community of social workers as professionals like there is here, and so I just decided I'm going to apply. I'm going to apply to this school. It has the clinical element that I'm looking for, and then as far as my job goes, it's kind of like Katie said, like I'm very open, and it was the first opportunity that presented itself to me that would give me what I was looking for out of a job, which was to grow my Spanish language skill set and to get my C hours. And, pay and benefits and all those things are important too, right after you graduate. So, it was a number of things. And I knew too that it would allow me to grow professionally. Like I was going to be put in a position that was going to be uncomfortable, and I was going to have to learn and take on new skill sets. And so I jumped right in.
Great. And now that you've kind of navigated us through your pathways to working in healthcare, I think it would be interesting for students to kind of understand maybe some of the more surprising things you've encountered so far in your career, and whether those are positive or negative. I mean, they're all important. So if you wouldn't mind just telling us a little bit about what you've found surprising so far.
I can start with a challenge if that's helpful.
That's very helpful.
So I knew none of the medical terminology or anything. Like my first day at my first job at Mount Sinai, we had a 2-week orientation, which is lovely and such a luxury. But the first day, they're just rattling through all these really common medical conditions and diseases that probably a lot of people know. And I knew they're using the acronyms now, and I did not know one thing. And so I was sitting there like, oh my gosh, I know nothing about this job, and I'm starting, and what am I going to do? So that for me was a learning curve, but you learn that as a social worker, one, you're not the doctor, so it's not my job to really know the ins and outs of everything. Although at this point, I sort of do know the more common medical conditions, but for me, that I guess was surprising and also challenging. Just the learning curve of the medical piece, having no background and also no healthcare background, the different insurances, all of that, even services available to people. I'd really never done case management. I said I'd really, really clinical, just therapy. So for me, that was a learning curve, but also probably the best way to learn it is hands-on. So if you ever find yourself in a position where, that all seems new to you, you will learn it.
Mm-hmm.
I would say what's surprising for me is that when I first started, feel like I was preparing myself for entering the workforce, and I wasn't really prepared for the amount of people who had these like dual diagnosis conditions, and meeting so many people who had like this list of 6 conditions, 25 medications, and that seemed more like a case study to me, before starting. And so going into it, seeing hundreds of people that had just these laundry lists of everything that was going on with them, and that's just like their physical and mental health stuff. There's also everything else of like homelessness and not receiving benefits and not having food on the table. So it was really surprising just to see how many people required so many services.
So I think one of the strengths of being a social worker in the healthcare field is that there's so many different positions you can do, but I also think that's one of the surprising things, that it's constantly in flux, or at least I'll use the HIV world as an example, which also is something I didn't know anything about. I had to learn on the job, and my role also did include some health education, so I was actually supposed to know what I was talking about, so I really had to learn a lot as I went. But I've seen in my 4 years now of being there, working in the same clinic, how the services we offer shift with the changing political tide, or with different funding. Like, a lot of our programs are funded through grants, and so the work we actually do has already been decided for us at the state or federal level. For HIV, it's gotten a lot better with treatment, and so there's still a lot of services for being in care, going to your appointments, but now they're realizing that we can also prevent a lot of HIV, so then they funneled more money into prevention. And so I actually got to see how positions were created, like, from my perspective, overnight, to address how the field is changing with the medical sphere. So that was really surprising to me.
Yeah, what everybody said so far resonates with me as well. It brought me back to what Lena was saying. My first week on the job, I remember I went to my supervisor and I was like, it was like diagnosis code for, like major depressive disorder, something like that. And we use ICD-10 in the medical world. And so I was like, oh, what's the diagnosis code for that? She's like, I don't know, I just Google it. And I was like, okay. Like, I had the expectation that she would like know all these codes off the top of her head, because she'd been doing this for 13 years and, the various, in her role, but like the program had changed over time. And Google has become my best friend. Like, if I don't know, a medical term, I'm Googling it, I'm reading about it, educating myself so then I can educate my clients. Because what I found, challenging is that my clients sometimes there's a disconnect between the provider and the client, and so my job is to bridge that disconnect and to kind of just break it down in a concrete way. Like, well, you have diabetes, and so you can't eat this, and you can't drink this, and you should check your blood sugar, and call me if you want to tell me your blood sugar if you can't write it down, because clients sometimes are illiterate. And like my role. One of the challenges, I guess, that I had was that I had to learn in the beginning to separate myself from what my clients are going through, because it was very draining. Because, as Brian mentioned, like, people have a lot of complex issues going on, and to see that and to work with that every day can be very draining. And so, as a new minted social worker in this field, I think you pour your heart into it and you want to give your clients everything that you can, but it can also be draining for me personally, as the clinician, to not have a boundary there of saying, like, well, this is what I can give this person. And for me, that's kind of been like the last year, like, figuring out what that is. Because I remember people talking about that when I was in school, but when you're in school and you're in an internship and you have like a small caseload, it's a different story. So, yeah.
I think it's important for students who are thinking of going into any organization, really, to think about the culture that would fit well with them within that organization. And I would assume that in a mental health or clinical setting or anything like that, it's kind of its own world. So I guess I'm curious to understand how you found the organizational culture and how you came about to recognizing that you would fit in there.
So I feel like your interviews are really important, and obviously they don't say everything, but I think when you're being interviewed by a prospective employer, like as much as they're interviewing you, like that really is your first opportunity to get a sense of them and the kind of work culture. And if you're lucky enough, they might also be introducing you to certain staff and other people you'd be working with, and you can really get a feel. But for me, I think, as everyone said, like we work with intense cases and complex issues, and there's like a lot of heaviness, and it can be hard and it can be draining, and you can take it on. And so for me, being somewhere where there's humor and people do not take themselves too seriously, I've learned is the most important thing. So working with people who take their work very seriously but do not take themselves too seriously. And I do think, of course, you can't learn everything from your interviews, but you can take that time to see how you really do connect with the person who's interviewing you, especially if they're going to be your supervisor. With my new position, all three people I interviewed with were all either going to be my supervisor or a peer in some way. They were going to be integral to my new job. And just feeling out, like if I felt fully comfortable in the interview, just really trying to connect with them and see, like, could I crack a joke? Like, obviously there's not always the place for that, but for me personally, it's important to be in a setting where people can laugh about things and, again, don't take themselves super seriously, because there is so much seriousness in our work, and it can get really heavy. And I think trying to figure out a culture or find a culture where there's some light, for me, has been really important and definitely prevented burnout and feeling overwhelmed and things like that.
Well, I think that even just the initial stages of applying can be really hard, and especially as a new grad, I was just kind of applying to most places that would accept new graduates. And I think at the time I was just kind of trying to find something. Luckily, the agency that I was interning for had offered me a position, and the program that I was in, it was fledgling. I was the first employee of that program, and so I didn't really have that opportunity to kind of ask certain questions because I wasn't really sure what was going to come about. So it was kind of exciting to be in this new program, develop some of the organizational aspects for myself and also my coworker who was with me for the first 6 months. And it was an interesting experience because we didn't have a direct supervisor for quite a while, maybe 6 to 8 months. There was a consultant helping us out, and for the health home that Brittany's in, it's very difficult when you have kind of these high caseloads. So going into interviews and things like that, just thinking about what will the caseload look like? What are your own expectations? What can you manage yourself? And just taking that experience from what you've learned at your internships and bringing it forward, and just knowing your boundaries, I guess, and knowing what you're able to bring. I think that'll help you with the interview.
Yeah, I think I didn't get to meet a lot of people at the organization when I was interviewing, but one of the people that did interview me actually was also an NYU alum, and so I think we had a basic connection at that level. And then something I really liked that I heard her say at several points when describing the position to me, she really focused on learning and growing, and then after you've learned and grown, moving on, and how there would be other opportunities and ways to grow, and that's something they supported. And so that was really appealing to me. But the other thing that I really liked is Harlem Hospital is a city hospital, and so that can have bad consequences sometimes because there's not the level of resources that other places might have, but at the same time, at its core, that means they're really there for the people, and they'll treat you regardless of your ability to pay or to say thank you or to be nice. And so I think that really appealed to me, the feeling of, okay, this is a culture that doesn't turn anyone away, that wants to provide help for anyone equally. And so that was really appealing. And you could tell just that's in the mission statement, so you could actually read that.
Yeah, I second what Lena said, about the job interviews. I use that as an opportunity to, as much as I was being interviewed, to interview the potential employer. And for me, it was like I just felt a sense of like support, and that there was a team environment that was happening, and I just kind of lucked out that my workplace culture is amazing, and we support each other, and we laugh on our lunch break, and we get another part of my culture, I think, at my job is that it's a union position, so I get, my standard hour break, and I don't get paid for that hour, so we make sure to take lunch as a family kind of every day, and we all sit at the table together, and so it's nice to have that environment.
Yeah. And then I guess as sort of a follow-up, in addition to understanding the organization that you're going to be going into, what, if any, are things that you wish you had learned or wish you had done prior to entering a health setting?
I think for me, I wish that I had trusted myself more and my instincts, actually, because I was one of the only social workers in my team when I started. Other people had been in different fields. One was a lawyer, one was a health educator, one had worked for random agencies, and so I was the only one with the social work perspective. And so I think in the beginning I had a hard time defining, okay, what does it mean to be a social worker? What are the social work values, kind of coming up in contrast with the medical model, and my coworkers who are used to telling clients okay, do this, don't do that, okay, and whereas I saw it as, clients have self-autonomy, and you want to lead them to self-determination, and you want to respect them and their choices. And so I think I wish I had come in with a stronger sense of really being confident. I think when I graduated school, I still felt like a social work student, but once you graduate, you are a social worker, and I wish I had trusted my own instincts, because I later learned that for the most part I was doing the right thing. So
I totally agree with that, and I think especially in a hospital setting, when I started working with a team of doctors, and there is a natural just hierarchy, and being new, and exactly what you said, there are certain ways other fields and professions deliver information to clients and work with clients, and it doesn't mean you always agree with that. And so I think finding your own voice within that, which just probably takes some time, and getting comfortable and having the confidence, and I think for me, finding my role within sort of the doctors and the team that I work with.
I was thinking about when Lena was saying with going into it with understanding medical stuff and diagnosis. I probably wish that I would have paid a little more attention in Human Behavior 3.
Agree.
To understand, as controversial as the DSM is and all that goes into it, it's still very much a part of your job, especially if you're working with mental health. So really having a better understanding of the specifics for the more common diagnoses like schizophrenia, bipolar disorder, major depressive, all those things, because that will come into play at some point. And even if you're not the one that's doing the diagnostics or whatever, clients come to you with questions about some of these things because maybe they can't get in touch with their doctor. So I would say that HB3.
For me, I took advantage of a lot of the resources here at Silver, but I didn't use that to focus on a career in healthcare. So if I could go back and do it again, I would broaden my horizons outside of the things that I was focusing on when I was here, and I would have learned more about a social work career in healthcare.
Yeah, that HB3.
Sorry.
Yeah, speaking of diagnoses and things like that, as we all know, the political climate is always in flux here. Policy changes are always happening, and that's very important in a health or mental health setting. So how do you all keep abreast of these changing policies? Is there anything you do in terms of research or trying to stay in front of any changes that may happen?
I'm lucky where Mount Sinai really sends out like broadcast emails quite regularly when there's any changes that affect the hospital or our patients or us in any way. And also the social work department, as well as all the other departments, put on a lot of presentations regarding anything that's happening. So besides Google still being our best friend, like universally for everything, that's one way. But I'm lucky to be in a position where normally I'm getting an email about something before I even have to start looking into it myself.
I would say even in school and especially when working, I like to go to as many like meetings as I can that include like other organizations and other providers. Because they'll know they'll know things before I will, and I may know certain things before they will. The meetings can be sometimes a little dry, but overall, people are presenting relevant information. Especially at NYU, there's always I remember like a ton of opportunities to learn about various fields, something like this, other like organizations. So I try to feed off of other people's knowledge and their kind of what their take is on certain things.
I think for me, I also do the same. Like I try to go to as many trainings as I can, because besides learning what they're presenting on, it's a chance to meet people from other agencies, kind of talk informally about what's going on, learn about trends, something maybe you thought was unique to your organization, something like a change you hear is happening everywhere, and you put together like a bigger picture. Also, I just signed up for a lot of email like listservs, like for the HIV world, they have like a lot of research blogs that will like send you updates and actually say like, okay, here are all the findings from these studies. They like boil it down so you don't have to read through them, and so that's really helpful.
Yeah, I mean, what everybody said pretty much.
Yeah. And then in addition to that, I guess this is sort of related, but a lot of the students here are going to be graduating either this year or sometime soon. And professional development it's a topic that everybody is starting to talk about. And I wanted to know if there's any professional organizations you guys are a part of that is related to your industry, or maybe not related, and also how you kind of how you're still developing professionally even in your career.
Besides NASW, which I think like most people know of and or are part of, something that I'm on the email for, a lot of the psychotherapy training institutes around Manhattan and elsewhere offer really great presentations and trainings, and a lot of them are free, or they're $10, or it's donation based. So when I was in school, I mean, my second year internship, I was at a psychodynamic training institute, so that's sort of how I got into that world. But there's a bunch of them throughout Manhattan, and they offer a lot of things. And it's not just psychodynamic, it's a lot of different modalities, a lot of different therapy techniques and skills. And you really meet people at those too. Like they'll sometimes have like a short reception before or after, and so it's also a good networking opportunity. So I would definitely encourage you to look into sort of those kind of places. And it's a lot of social workers, and some are therapists that are licensed marriage and family therapists or something else. But it really is a good place to be, especially for mental health, I think.
I would say I like to go to other professions events that are related. So like the City Bar will have a lot of free events that have very much related topics where social workers and attorneys will go together. And that's a great way to keep up on policies, especially around immigration, violence prevention. The City Bar really focuses on those topics that are really relevant to this work. So it's not just like our world, it's also others, like doctors associations, lawyers, and people that we interact with constantly throughout our careers.
Something that I didn't actually mention before, but I thought I would, is that when I started, I didn't really get great supervision. And so one of the ways that I overcame that was I kind of sought out my own networks of supervision. there were psychologists and social workers in other programs at the hospital, and so just sort of informally, sometimes we would spend our lunch breaks talking about things, and I found that as a way to develop professionally, even though it was very informal. Also, after graduating, I kept up like a monthly brunch with some fellow social work students, and we all went to different fields, and so we would kind of meet up once a month and tell each other like what we were learning in our jobs, which was also a really great form of self-care. So, like, I would strongly recommend that. But I also learned from that, and I learned what they were doing. And then, yes, I'm a member of the NASW too, and try to go to as many meetings as possible.
Yeah, I mean, of course, the NASW and the union that I'm in is a healthcare union, so they have seminars and events, and there's learning opportunities through Montefiore itself. So tomorrow I'm actually going to one on effective communication that we have in like a talent management portal that you can find. And then, yeah, I do like a monthly dinner with a group of social workers that I graduated with, so we can all informally talk to each other and talk about our jobs and what's going on. And
very good.
Yeah.
I have one final question, actually, before we kind of open it up to see if anybody in our audience here has any questions. But this one's kind of important. So what advice would you give students who are interested in going into the mental health industry?
I think we might have already said some of these things, but I'll just repeat them. I think
whatever you think is most
for
important.
me, being open-minded and flexible about what my first position looked like, just because I know, I think different strategies work for different people, and I knew some people who had a really clear idea of exactly what they wanted to do after graduating. Like, one friend wanted to work in eating disorders at an inpatient unit at a hospital in New York, and she actually got that job, which is great. It took her a little while, but she got it, and I think that was really exciting for her. But for people who aren't completely set on what they want to do or are still feeling it out, like trying something, even if you're not sure, as long as you know you'll learn something from it. And then I think sometimes you'll have the opportunity to switch to different roles after being introduced to that first one. So, I mean, unless it seems like awful or something you're not interested in, like being open-minded to working with a different population than you have before or in a different setting. It worked for me, so.
I think definitely being open and flexible is super important when we're starting out our careers, and always. But I also think if you make sure that you're getting what you need still. Like if you really value a place that will let you grow and that there's professional development, and you realize that's not happening there, then you don't. I think we want to be flexible and open, of course, to a point, which is what you're saying, of course. So I think also just knowing yourself and what you need, and if you feel like you're not getting it or don't have the supervision or something, also listen to that too, because even though it is your first job, you still, I think as all of us have, can have a good experience and definitely deserve to get out of it whatever you think you need.
Definitely, I agree.
I mean, I think it definitely starts at NYU for the classes that you're taking, and it's kind of a balance, because if you have an interest, you should definitely pursue that in terms of the classes, but also diversity in classes, because in social work, even if you choose to work with a very specific type of population, chances are you're going to run into other populations anyway. So it's best to just educate yourself on almost everything that social work encompasses, in addition to kind of what you want your specialty to be. Because again, we help everyone, even if it's someone working with survivors of sexual assault. That's everyone. That's men, women, trans, immigrants. It's really everyone. So just keeping that in mind as you're kind of wrapping things up and going into last semester and all that, just broadening your horizons, I think, generally.
I think what Katie said earlier about trusting your skill set and the knowledge that you have as a result of being here at Silver, when you graduate, you are a real social worker at that point, and you have a license. And for me in the beginning, it very much felt like I didn't know what I was doing, and because the field was so new to me that I had to learn the community, the resources, the population. But I had the education from Silver, and so to like lean on that and to trust that.
Mm-hmm. Great. So thank you all so much. This has been a really fascinating and enlightening conversation, but we have a few more minutes. I wanted to see if anybody here has any questions for our panelists.
So I'm interning at a city hospital right now, so I see what all the unit social workers do, but Katie is mentioning the different roles and positions. Do you mind elaborating on the kind of different roles and positions in the city hospital?
Sure, yeah. And I think mine is also able to be varied because there's a lot of grants, and so they hired a lot of additional social workers beyond what the hospital itself employs. So we have social workers who deal with like inpatient discharge planning. Then there's social workers in the health home program. There are people who work with more medical case management. I think there's a lot of different case management roles specialized for different populations, but then there's also like support group leaders, or there's an office that works with domestic violence or sexual assault, more legal issues. So I don't know that I meant not so many positions, but so many different ways, like not just the clinic social worker, not just the unit social worker. I think and then there's a social worker that actually supervises all the grant programs. So we have a pretty varied mix of social work responsibilities, at least in my program. Yeah.
Any other questions from the audience?
Could you talk a little bit more about, I think it was mentioned, how you take care of yourself when you're dealing with such intense cases with so many different issues and, the various barriers that you're dealing with in the system and the lack of services or resources. How do you sort of work through that and still take care of yourself and have hope and give your clients hope? Are there certain things you do or supervision that you get, or what helps?
I think your support system, both in and out of work, are really important. But at work, if you're lucky to have a supervisor you're connected with, I think that's I have that. That's a great place. And then also really your peers at work. And for me, that's not just other social workers. That's the doctors. That's our front desk. That's our nurses. That's our medical secretaries. It's our medical assistants. It's everyone. And so, because we're all really working with the same patients, just in different ways, but everyone can sort of feel what it's like when it's an intense case and when it's complex and it's really challenging. So I think really utilizing your support system, whatever that is, inside and outside of work, has been really helpful for me.
I've been pretty fortunate so far with the amount of time off that I've been given at my job. Just on Friday, I took a personal day because it's there and it should be used. And so, and it was nice, sleep in, go for a run. That's, if you have the time off, use it without kind of that guilty feeling. I had to take the email off my phone because otherwise I'm on 24/7. So just kind of it's just knowing that it's okay to step back and take a minute for yourself.
I would agree with what Brian said. My first year, I would stay late a lot of days, and other people weren't staying late. This was something I did to myself because I felt I hadn't finished the work for my clients. And so slowly over time, I still respect my clients and I want to help them, but I also want to respect my time. And when the day is over and everyone else has left, I now leave too. But it was a transition for me because I did want to give my everything, like Brittany mentioned. And so I think I had to really work on boundaries. But I knew that in school. We talked about it so much in school, and I knew, that's going to be an issue for me. I know it is, and it was, but I've gotten better. Just being patient with myself. Also, the simple things like going for a run, exercising, meeting up with your social work friends, meeting up with non-social work friends, reading for fun. Just try all the things that I think we do talk about in school. They have been working for me, so that's good.
Yeah, for me, it's when my day is over at 5, I leave my work at work, and I try not to bring it home with me, and I leave my phone at work, and, you know, not being connected all the time. And it's taken me a while to, you know, be able to disconnect mentally and emotionally when I'm not at work from my clients. And of course, you know, it comes back sometimes, but trying to just really, you know, when I'm on my time, live my life and do what brings me joy. And, you know, trying to explore avenues and ways that I can advocate and use, not just for my clients, because I get disenfranchised a lot along with my clients in the various systems that I'm advocating with them, especially the NYPD, but advocating outside on my own time in my own way. So for me, that's like advocating for recovery resources for people that have substance abuse disorders.
All right, well, we're pretty much out of time, but I did want to thank the panelists again for coming in today and sharing your experiences and your career paths. It's really helpful for our students, so thank you.